Insulin is a hormone made in your pancreas, a gland located behind your stomach. Insulin allows your body to use glucose for energy. Glucose is a type of sugar found in many carbohydrates. The body processes glucose like this. After a meal or snack, carbohydrates are broken down in your digestive tract and changed into glucose. That glucose is then absorbed into your bloodstream through the lining of your small intestine. Once glucose is in your bloodstream, insulin signals cells throughout your body to absorb the sugar and use it for energy. Insulin also helps balance your blood glucose levels. When there's too much glucose in your bloodstream, insulin tells your body to store the insulin also helps balance your blood glucose levels. When there's too much glucose in your bloodstream, insulin tells your body to store the leftover glucose in your liver. The stored glucose isn't released until your blood glucose levels decrease. Your blood glucose levels may decrease between meals or when your body is stressed or needs an extra boost of energy. Managing diabetes with insulin. Injections of insulin can help manage both types of diabetes. The injected insulin acts as a replacement for, or a supplement to, your body's natural insulin. People living with type 1 diabetes can't make insulin, so they must inject insulin to control their blood glucose levels. Many people living with type 2 diabetes can manage their blood glucose levels with a lifestyle changes and oral medication. However, if these treatments don't help control glucose levels, people living with type 2 diabetes may also need supplemental insulin. Types of insulin treatments. All types of insulin produce the same effect. They are used to mimic the natural increases and decreases of insulin levels in the body during the day. The makeup of different types of insulin affects how fast and how long they work. The type of insulin you'll be prescribed will vary depending on things like 1. Your age, 2. Your activity level, 3. How long it takes your body to absorb insulin, 4. How long insulin stays active in your system. Types of insulin. There are several types of insulin available that vary in how quickly and how long they can control blood sugar. Frequently your doctor may recommend combining more than one type of insulin. To determine which types of insulin you need and how much you need, your doctor will consider factors such as the type of diabetes you have, your glucose levels, how much your blood sugar fluctuates throughout the day, and your lifestyle. The general types of insulin therapy include E-long, ultra-long or intermediate-acting insulin. When you're not eating, your liver releases glucose so the body continually has energy. Long, ultra-long or intermediate-acting insulin helps the body use this glucose and keeps glucose levels from rising too high. Examples of these insulins are Glargine, Lantus, Toujeo, others, Detamir, Levemir, Degludec, Tresiba, and NPH, Humulin N, Novolin N, Novolin Relion Insulin N. These insulins work for between 8 and 40 hours, depending on the type. Rapid or short-acting insulin. These insulins are ideal for preventing blood sugar spikes after you eat. They begin to work much faster than long-acting or intermediate-acting insulins do, sometimes in as little as 3 minutes. But they work for a much shorter period of time, usually about 2 to 4 hours. Administration and dosage. Insulin is most commonly administered through a syringe, insulin pen, or insulin pump. The type of insulin injection you use will be based on your personal preference, health needs, and insurance coverage. Your doctor or diabetes educator will show you how to give yourself the injections. You can inject the insulin under the skin in many different parts of your body, such as your thighs, buttocks, upper arms, abdomen. Side effects and reactions. Side effects from injecting or receiving insulin are rare, but can occur in certain cases. The symptoms of mild allergic reactions are swelling, itching, or redness around the injection area. More severe insulin allergies may include nausea and vomiting. In either case, talk with your doctor if you notice any of these signs. Hypoglycemia, or blood glucose levels that are too low, can sometimes occur when you take insulin. It's important to balance the insulin that you give yourself with food or calories. If you exercise longer or harder than usual or don't eat the right amount of calories or carbs, Your glucose level can drop too low and trigger low blood sugar. Symptoms of low blood sugar include fatigue, inability to speak, sweating, confusion, loss of consciousness, seizures, muscle twitching, pale skin. Typically, a blood glucose reading of less than 70 mg per deciliter, milligram per deciliter, is considered too low for almost anyone using insulin, but you should talk with your doctor about what is too low for you.